Michael Tanner with the CATO Institute, senior fellow at the CATO Institute, author of The Inclusive Economy, How to Bring Wealth to America's Poor. He penned a great piece at National Review just a few days ago, and the headline was this: the questions that Medicare for All supporters must answer. And he joins us right now, right here on Montana Talks. Mr. Tanner, thanks for being with us. Great to have you this morning.
A pleasure to be with you.
Yeah, so what's the most important question that Medicare for All supporters must answer first?
Well, I think the obvious one is how exactly are they planning to pay for it? If you look at the latest proposal that Bernie Sanders has introduced, for example, we don't have a CBO score on it, but his earlier versions cost between $32 and $38 trillion over the next 10 years, according to outside estimates. And his new version is actually more expansive, adds in a long-term care or nursing home benefit and some other benefits that weren't in his previous version. So we should expect it to be somewhere between 35 and 40 trillion over the next 10 years. That's real money even in Washington. Someone's going to have to pay that money.
Michael, again, thanks for being with us this morning. So you were talking about, look, this $32 to $38 trillion, and that was before he stuffed all these other freebies inside of his Medicare for All plan. I know the big question that people like you and I would ask is, okay, well, how are you going to pay for it? But what's this phrase? Is it modern monetary theory, where our friends on the left don't even think that question is relevant anymore? You don't need to know how we're going to pay for it because it'll just magically appear after we give away all this. We just spend the government's money and don't worry, it will be fine, is their argument, right?
Well, that is a theory that's out there, and particularly one that Bernie Sanders embraces. His chief economic advisor is largely the woman who is responsible for this. As far as I know, there are very few, if any, reputable economists on any side of the political debate, left to right, that actually adopt this idea that basically says that as long as you're printing your own money, you can go ahead and print as much as you want, and it's not a problem.
Yeah. And so, and apparently he's not releasing really any details about how he would really kick people off of their plan, although we are kind of getting an idea based off of some of the tax hikes that he's looking at, including one of the other possible things. I mean, this increase in the payroll tax. I mean, you want to talk about something that no matter when we cut taxes, it's like, if you're working class or poor, the payroll taxes still continue to hit you. And so he's apparently one of the ways they would try to pay for this is through a massive increase in the payroll tax also. What are some of the other things?
Well, that's right. And, of course, income tax hikes, wealth taxes, and taxes on financial transactions are all things that they consider. Now, in fairness, we should say that people would no longer have to pay insurance premiums or co-payments or deductibles. So, at least for some individuals, they would be better off. But if you look at the overall distribution of how these taxes would hit, essentially people in the middle class and up would end up paying more.
And then what would be the economic impact from all these high taxes? The very wealth tax that Bernie Sanders could pay right now but refuses to pay right now.
Well, that's exactly right. What you're going to do is basically put a tax on risk-taking and entrepreneurship and investment. Those are sort of the three things we need to grow an economy, and those are the things that they're going to most discourage if they have to go down this essential tax and spend route.
The famous line from President Obama about Obamacare was, well, if you like your doctor, you'll be able to keep your doctor. That quickly was proven to be false, unfortunately. But now the question is, if you like your insurance, will you be allowed to keep your insurance?
That's a big debate within the Democratic Party right now. Bernie Sanders, of course, would basically prohibit private insurance. So if you get your insurance now through work and you're happy with it, or you've bought an insurance policy that you think satisfies your family, you would lose it. You would have to go in the government system. It would be mandatory that you would be part of the government system. Private insurance would go out of business, essentially. Kamala Harris essentially has been on all sides of this. She sort of was in favor of the Bernie approach and then against it, and now she's sort of in favor of it again. It's kind of hard to tell. Some of the other Democrats have endorsed it. Meanwhile, other Democrats have come out against it and said no, that they want to maintain private insurance alongside Medicare for all. They're going to keep both plans in place so that you'll be able to keep your insurance. We have to wait and see how that's going to play out, but Democratic candidates should be required to answer the question of which side they fall on.
Well, and even if they didn't ban private sector insurance, even if they didn't put a ban against it, I mean, wouldn't they effectively be doing so because the costs would have to be so dramatically shift to those who still had private sector health coverage that effectively it would be so unaffordable that you would see an effective ban on private sector coverage almost.
Well, it would hurt private coverage in two ways. Number one is, as you say, right now, government programs basically under-reimburse providers, and those providers then shift the cost to people with private insurance. If that happened throughout the healthcare system under the Medicare for All, the private insurance premiums would inevitably rise. At the same time, the Medicare for All plan is subsidized by taxpayers. It can always sort of underbid in terms of premiums because it's not competing on a level playing field. So it can sort of have predatory pricing that will drive out private insurance from the market.
Back into our conversation here with Michael Tanner, a senior fellow at the CATO Institute, talking about Bernie Sanders and Medicare for All, the questions that Medicare for All supporters must answer. Michael, I wanted to go back to this topic about, because we do a healthcare discussion with one of the great doctors from one of our hospitals here every other Tuesday on this show. And so we've kind of talked about this reimbursement issue. A lot of people don't realize this, but all of our hospitals get dramatically shortchanged by the federal government. So what that means, the way I see it, the bottom line is, okay, so the more people that have their health care paid for by the federal government that go to our hospitals means the more that you and I, who have to pay for our own health care coverage, have to pay to make up for them. Talk about the low reimbursement rate that the federal government gives and why that would be an even greater threat to these hospitals in the future if there were a Medicare for All plan.
Yeah, the estimates that I gave earlier for the cost of Medicare for All, the 32 to 38 trillion, that assumed that providers across the board would take a 40% cut in their income. That's hospitals, doctors, and so on. I mean, it would be higher for some, lower for others, but on average, across the board, a 40% reduction in income. That's a pretty substantial hit for doctors. Now, where can they offset that money? They can, of course, try to shift that to people with private insurance, but if the private insurance doesn't exist, or if people won't pay for those kind of premiums, they're out of luck there. The result then is they can simply stop treating people. We know that already some doctors won't take Medicare patients or Medicaid, which reimburses even lower. We know that that's a problem. What you may get with Medicare for All is that many of the best doctors, those that charge the most, are simply going to drop out of the system, or they're going to find ways to basically treat the rich off the rolls.
Yeah, but it also raises questions too of, okay, well, what is the future of health care in this country? What is the future for these hospitals? I mean, if they're eventually just going to become the meal counter on the lunch plan of the federal government, what does that mean when it comes to quality of actual health care? And yeah, do people decide not to go into that industry anymore because it's basically just, VA for all or something?
Sure. We're talking price controls here, and we know that the ultimate impact in price controls is to reduce innovation. Can you imagine that if we went back to, say, 1950 and we froze prices so that they could not rise on anything in healthcare from the 1950s? Some people would say, great, that's wonderful. We also wouldn't have most of the healthcare that we have today in terms of new medicines and new medical procedures and transplants and all the things that extend life today would simply not exist. We would have 1950s medicine still, and I don't think anybody really wants to go back to that.
We've just had, I don't know how closely you've been following the Medicaid expansion debate that was, a direct result of Obamacare, but we just had the Medicaid expansion debate again here in Montana because it was passed in a previous legislative session, but they had to readdress it again here during this current legislative session, and they got some moderate Republicans to team up with Democrats to pass Medicaid expansion. Now the moderates will say, hey, we added some work requirements to it, so we at least tried to improve Medicaid expansion. But nonetheless, that's going to raise some of these same costs, which is, hey, here you got more folks who are who are going into the system that are getting this low reimbursement rate from the federal government, and it's just going to pile up cost. But what that says to me is now the rest of us are not only going to pay more in taxes, a higher share of our tax dollars are going to go to support that, but then we're going to pay more for our own private health care coverage to make up for it as well. We're going to get hit on two fronts.
Yeah, that's a potential problem, but even more likely is that doctors will simply not take Medicaid patients. We know that about a quarter to a third of physicians, primary care physicians, will not take Medicaid patients. That's one reason why Medicaid does not appear to actually improve health outcomes or reduce emergency room visits. The best study out of that is out of Oregon, and it showed that there was very little measurable change when people moved on to Medicaid. And the biggest reason is that they still can't find a primary care physician who's willing to work for those low rates.
I had kind of a fun conversation. So last week we had Charlie Kirk and Candace Owens from Turning Point USA in Bozeman, Montana. They did their Campus Clash event. And I don't know if you're familiar with what they do, but they open up the microphone to anybody at the end for Q&A, and they have their critics step forward first. So this one liberal guy gets up, and he's saying how great socialism is. He's a big Bernie Sanders guy. Turns out he's a frequent caller into the show, so he joined us the next day, and I was like, hey, wait a minute, you're the guy who was just mixing it up with Charlie Kirk last night. But anyway, it's kind of funny because he was saying how great socialism is, and then somebody, I think Charlie Kirk or Candace brought up Obamacare, and he's like, oh, don't worry, Obamacare's killing me. And they're like, well, that's socialism, bro. But anyway, what he argues, he doesn't like Obamacare. He sees Obamacare as just another step to get us to, Medicare for all, to basically to socialism. But he says, well, there are no restrictions right now. There are no restrictions in terms of because my argument is we need more free market solutions to our healthcare problem. We need more abilities to be able to choose our own healthcare options, and that gets severely limited as a result of federal regulations and federal laws. So, but he claims no, that's not the case. There's no restrictions right now.
Well, there's certainly some. I mean, the healthcare marketplace is hardly a free market. For one thing, there's licensing restrictions and other restrictions on the supply side that severely limit non-physician providers. That a dental hygienist, for an example, cannot practice independently of a dentist's office. I mean, just to cite one classic example that drives up the cost of something as simple as cleaning teeth. On the other side of that, much healthcare, about 52% of all healthcare in this country is subsidized by the federal government, from Medicare and Medicaid to Obamacare to military health plans and so on. So the federal government is actually subsidizing or paying for most healthcare in this country. And then finally, on the insurance side, what insurance companies must cover, what the deductibles can be, what the plans must cover in terms of benefits, who they must cover. All of those things are regulated by both the federal and state governments. There's dozens of mandated benefits that the state of Montana imposes on top of those that were in the ACA.
So if you could propose a policy prescription, if you could get members of Congress to listen, what would you tell them how they need to actually fix healthcare in this country?
Well, essentially what we want to do is create more competition on every level. That means we want more competition on the provider level by opening it up to non-physician professionals. We want to force costs down on the provider level. But at the other hand of it, we also want to create competition among insurers and other payment mechanisms, whether that's health savings accounts or flexible spending accounts or whatever they might be. We want as many participants in the marketplace as possible. We know that competition improves quality and drives down costs. I mean, just look at computers. I mean, when it wasn't that long ago, it was half the size of a house and cost a couple of $1 million. And today it's in your cell phone, and they give it to you for free when you get a 2-year plan.
Yeah, and I've been in third world countries that have, with folks in poverty situations that have nicer cell phones than sometimes some of my friends back here in the United States have, with how that's even happened all over the world. Yeah, anything else that we've got just a couple of minutes left here? Michael Tanner from the CATO Institute. Anything else that we didn't cover yet?
Well, I think the Affordable Care Act is obviously deeply flawed. It has driven up the cost of insurance. It has limited provider networks. It has made it more difficult for people to get the type of insurance that they want, but it has, on the other hand, extended coverage to a great many people. Republicans have got to find a way to come up with a successful alternative rather than simply leaving it to the Democrats. And right now, the Republicans, from the president on down, seem extraordinarily inept when it comes to discussing health care. They can't beat something with nothing.
Yeah. And they had control of Congress for at least 2 years. Why didn't they get off their butts and do something about it instead of waiting until the last minute? And now Nancy Pelosi's there, and they seem adamant to oppose any sorts of real reforms because they just don't want it to look like President Donald Trump has a victory. So they'll block forward progress for the American people simply so that they can deny President Trump a victory.
Well, it's certainly deep philosophical divide between Republicans and Democrats, but before the Republicans can take on the Democrats, it would be nice if they actually came to a consensus themselves, and right now they're not even close.
All right. Michael Tanner with the CATO Institute. Greatly appreciate you joining us this morning here on Montana Talks.
Anytime.
All right. Great to chat with you. Yeah. That piece. Check it out, nationalreview.com. The questions that Medicare for All supporters must answer. In fact, I'll link to that later today at our montanatalks.com